Public memory is too short. Public memory is too short. That is a very old saying, but we have experienced it in the recent past itself. The amount of scare that the people had in the first wave and second wave, it just disappeared. Dr. Swami forgot to mention about the number of vaccines given in my unit. We gave 34,000 doses of vaccine in our unit. And there used to be a 1 kilometer queue to start with. But in the end, trust me, I was giving only 10-20 doses in a day. That too, I used to go into the student crowd and convince them to come back for vaccine. 2-3 weeks ago, the TV started projecting that there is a big havoc in China. At that time, people started coming to me and asking for the third dose. When the vaccine was available with me in plenty, nobody bothered to come for the booster dose. But now, people are coming and asking. Now it is available, but it is not free. They have to go to some corporate hospital where they have the stock. They have to get it done. Okay, this is what I mean by public memory is too short. Second thing, no respect for preventive care. Just because you use the word prevention, don't think of some disease. Just take a road traffic accident itself. Why did the accident happen? There were several risk factors involved in that. That is a bad road, a bad traffic discipline, and we don't honor other sentiments. These are all. But the accident happens. Accident is an event. But why did it happen? If we look at it, there will be definitely modes to prevent it. The third thing is, people are very complacent. They wait for others to do something. So, what are the solutions? Now we can plan as teachers and doctors, start training from early childhood. Whatever they learn during the formative age, what I said, 4 to 9, they will never forget. Never forget. Take it from me. I've seen this. I've experienced it. Respecting everything. Cleanliness, personal hygiene, environmental hygiene. Okay, if somebody is spitting in the road, they will boldly go and ask, uncle, what is this? Why are you just spitting indiscriminately? This is it. Now we have discouraged our young children from asking these things. After listening to these words several times, they will get discouraged. Hey, what is this? Why should I just take beatings from others? Let me not attempt at all. This is what is going to happen. So the slogan, prevention is better than cure. This is not a slogan made by me, but it goes a long way because there is no cure for HIV. There is no cure for dengue. They come, stay, go on its own. And similarly, there is no cure from my side even for COVID. It comes and goes on its own. But while going, sometimes it takes our life also and goes. Third thing, when instead of waiting for others to do something for us, let all of us join together to do something. That's it. Now, in this group of disaster, we can have two groups. The nature related, which is not my purview. I think you will be having 1 or 2 topics related to this because we will be forced to use our young population to cater to the needs of victims of this nature related furies. So instead of training them during the havoc, we can definitely train them in advance, and whenever the situation arises, we can make use of their services. Floods. We look at it, I mean, we get to see this very often. In our own state, we get to see this very often. Earthquakes, now and then, we will be seeing earthquakes. We will be hearing about this from other countries. Okay, that's it. The earthquake-related tsunami, what happened maybe about almost 18-20 years ago, which took away millions of lives. Tornadoes. Our North American, this thing is always known to have too many, this thing. Drought and excess rains. Even Karnataka faced excess rains in the last 2 rainy seasons. Okay, that's it. Now, let us not, I will just show 1 or 2 things. What is the societal preparation for mitigating the effect of these nature-related furies. But let me just complete the list of other disasters also, health-related. See, sincerely, I will tell you, that tsunami word was new to me when it happened somewhere in 2004, 2005. I had not, because maybe we learned our English from 5th standard onwards. Even the alphabets we learned in 5th standard. That tsunami word itself was new to me. Similarly, as a doctor, I had learned about endemic, epidemic, pandemic, zoonotic, and all that. But you people coming from other facets of your academic life, I think pandemic word itself was new to you. This is what I feel. I have asked many of our staff from our University of Mysore, pandemic itself was new. I will try to explain in brief what these words mean. Next is antibiotic resistance. Who cares? If you go to the pharmacy, medical stores, if you give money, even poison will be given to you. If you give money, it is enough. They will give you poison also. You need not worry. But trust me, it is going to pose a very big problem. A simple sore throat. A doctor will not have a good antibiotic to cure. You take it from me, because I'm facing it day in and day out. Sanitation and hygiene. This is a disaster. It leads to a disaster if you don't honor the simple sanitation and hygiene. Hand washing. It goes a long way in preventing a deadly disease like cholera and other non-communicable diseases. Just go through the list. If you are interested in any one of this, please ask me in between. This is a marathon session. My request is, if you want to contribute something in between, if you want me to clarify something in detail, you can stop me in between and ask. That's it. Look at this. Excess rains. I just, when I was preparing the slide, I just got an idea. Under health related, I have put a psychological thing as depression and suicide. A farmer who faces drought and excess rains, losing the crop, getting into the clutches of too much of debt and committing suicide. They're all almost like a multidisciplinary thing, interrelated to each other. One day, we individuals will be made to suffer. I think I have a slide on that. I will just, when I come to that, I will just explain that to you, why these nature-related furies also will become a big issue for an individual. Now, we theoretically define health in four dimensions. An individual who is physically, mentally, socially, and spiritually okay, not just free from some disease or infirmity. So only such an individual will be called healthy. That's it. As a medical doctor, I will be able to cater to physical health. But as social doctors, you will be able to cater to the remaining 3 dimensions of this health. So everybody is a doctor here. That is why I said, let all of us join together. But look at the other dimensions, economical or financial, whatever it is. If we don't plan something which suits our life, we will not be healthy. We will get into debt, emotional, political. Look at Sri Lanka, look at Pakistan. If we don't create a responsible government, responsible army, the political turmoil that goes on will definitely impact our individual's life. Take Ukraine. Our Karnataka students joining MBBS course in Ukraine, war, just sending them back to over this thing. Now, nobody can help them because our academic schedule, our competition, it actually will not allow us to put them into our medical stream at all. See how they are interconnected. Occupational. If we are not happy every minute of our occupational time, it will lead to a lot of stress. Even yesterday night, while preparing for the talk, I just got a pop-up message. What is that? Microsoft and Google will be laying out tens of thousands of people in the next quarter. See, how can anybody be happy? This is occupational. Then environmental. We just clean our house. We are least bothered about our road and other things. But if you are sincere, if somebody else is disturbing the environment, naturally, you will be hurt. That is it. You can buy a car for paying 25 lakhs, but you can't build a road. Similarly, it is every individual's responsibility to do a bit to take care of environmental health also. Whether it is not just a big word, that Swachh Bharat Abhiyan, global warming, they're not just a big words to be spoken only on the stage. Somebody will just clap and disappear. Nothing. If we understand one line and start implementing it in our day-to-day life, that is enough. That is enough. And intellectual. See, intellectual. Why I wrote this specifically is this Joshimath disaster. I think I have a slide on that. The National Institute of Disaster Management prevented intellectuals from going directly to the media talking something about sinking of the land in Joshimath. See, that's it. If your intellectual capacity is not rewarded by any means, it is not just money, it is not rewarded, you will not be happy. So that leads to, they are all interrelated. I will tell you, all these 10 dimensions of health, what I have written here, they are all interrelated. Somebody, if they are chronically stressed, they will become diabetic. So it started as a mental and emotional thing, will lead to a physical problem. Okay. So now instead of attacking the cause, as a doctor, I will be trying to repair the spoiled machine. Oh, your blood sugar level is this. This is what is my diet advice and medicine advice. Monitor the thing. If it is not under good control, keep on increasing the medicines. As a doctor, I have my own limitations. But look at you people as a family, as a society, what you will be able to do that. I'm not going to read this because this I just copied it from some other slide, but this is a very, very important slide. Please, I will be, yesterday I think I forwarded it. Today I will be forwarding the updated version of my presentation. Please go through that in your free time, and at least once in one term, every 6 months or so, ask your students to prepare a talk on this so that you will be moderating these talks and it will pay rich dividends in the end. See, look at this, whatever it is, it has got components. I will just take one or two of this. Look at this mental. Components of this mental health: knowledge, understanding, and wisdom. And the flourishing currency is when you really put them into understand and put them into a good meaning. That is the currency of mental health, not the physical paper or coin. What is it? Now, how this will be put into effect? It should become a habit. Whatever we do, we will be doing it with our mindfulness. Hey, no. As a doctor, I treat the patient. I pray God for 2 minutes before going to the hospital. What do I ask? See, people come with some trust to me. Whomever I touch, let them be getting good health, a good relief from my touch. That's it. But when that leads to an extreme, the deterrent will be distraction. I will just disturbed by what money I am getting it. See, this is the distraction for mental health. Okay, These are all the deterrents. See, in emotional, the deterrent is ego. Ego is okay. If it becomes super ego, whatever I say, look at our politicians. They will not allow any expert to talk on the related matter. Because of my political connections, I may become a minister of something. Will I become an expert in that particular portfolio? No chance. At least I should have the decency to listen to experts. Only thing is I can articulate and present it in a good way. That's it. Okay, go through this slide. I love this slide very much because this keeps me on the ground. I will never develop that headlong behavior. Maybe to suit the present scenario, I may act tough for a moment, but end of the day, no, I know what I am. That's it. Now, nature-related disaster, look at this. It is the same list. Look at this. These are all not my makings. These are all the same newspapers, what you people read. I just took it yesterday just to show what happens if we neglect nature. We have to respect nature. It is not any individual's responsibility or domain to do it. Every one of us. That's what I said. I can buy a car. I cannot make the road. Similarly, I cannot make the decision about constructing a dam or against that. I don't know. Look at this. Disaster. A result of deliberate negligence. We don't know. I'm not an expert. Some geologists, if you people are there in this particular crowd, you will be better, much better than what I am, just to say this. That's it. Look at this. National Disaster Management Agency directs organizations not to go to media and interact and share any data on the social media. Look at this. This is what is impinging on the intellectual right. That's it. So if an expert from ISRO or any other such organization, if they highlight the things, at least the public will become aware and they will prevent the reasons for this particular havoc in future. Whatever has happened has happened. That's it. Now, we use the word epidemic, pandemic repeatedly. Before getting onto the topic, just we will see what is this epidemiology. If you split them into three, epi, demos, and logos. Upon the people, study upon the people. That's it. Now, when an event happens, then I as a doctor always take health as an example. What happened? Where did it happen? A disease. What happened? COVID happened. Where did it happen? It started in China. When did it happen? The time. Last week of December of 2019. Who are the people affected? First, those people in the lab, the doctors and other healthcare professionals, catering to the needs of the patients, and that market where they were selling some live meat, something which is really annoying even to imagine. Who are the people affected? Why did it happen? We have to analyze. Why did it happen? Why did it start? Why did it spread? I have given you two very old stories, maybe in 1800s, what happened. Cholera, now we know nobody dies of cholera these days because as soon as somebody develops diarrhea and vomiting, we admit and do something to prevent deadly dehydration. Cholera will just stop on its own. There is no effective vaccine. Vaccine for cholera is just an eye wash. Just remember from this talk, there is no this thing. John Snow, he was not a doctor. He was analyzing where exactly this cholera epidemics, too many cases, epidemic means too many cases are happening. He traced it to one water source, a pump well, because it was all mid 1800. He traced it there. People who consumed water from that particular water source were affected. the scattered cases, 1 or 2 cases which were found outside that Broadway, that area was Broadway. They gave the history of visiting the Broadway and they spread to their surrounding. So this was the beginning of public health engineering. See, John Snow's meaningful, thoughtful analysis of that particular problem of cholera in 1800s led to public health engineering. Now we are all happy, our children are safe because of implementation of such a thing. Next is Typhoid Mary in New York. Just write down these keywords. Surf, you will get hundreds and hundreds of pages. This Typhoid Mary Mellon, working as a cook in New York, she was not well educated. She was not suffering from typhoid, but she was a carrier of typhoid bacteria, Salmonella typhi. So she harbored this bacteria in her gallbladder. So gallbladder was throwing Salmonella bacteria into the intestine and she was going to the toilet. She was not educated enough to wash her hands before touching the food she was preparing for the customers visiting the restaurant. And she was responsible for 10 to 12 big epidemics and about 50 deaths related to typhoid. Go through that. This is just an example. So this is what I said. I think I forgot I have given you a YouTube link also about the John Snow's this thing. I have watched this several times. Go through this, save this slide and go through that link. It will be very interesting. Like now, epidemic is, just try to understand the meaning of this word. Epidemic is defined as a sudden increase in the number of cases of a particular disease in a geographical area, which is clearly in excess of the usual expectation. We arrive at the usual expectation depending upon the previous 5 years number. We add those 5 years number and prepare an average. If this year's number is clearly in excess of the usual expectation, we use the word epidemic. Endemic is habitual presence of a disease producing agent in a geographical area. It is always present. Now and then I will be getting malaria cases, very few these days. But dengue, there is no season at all. Every day I get a dengue case. Every day, a blood test proven dengue case. Because I will be looking at minimum 100, 120 patients in a day. If I don't get a dengue case in a day, I will be very happy on such a day. That's it. The reason is these two diseases are mosquito-borne. One is a parasitic disease, malaria. Dengue is a virus disease. They don't spread from individual to individual directly. They need the via media of a mosquito. Anopheles mosquito for malaria and Aedes mosquito for dengue. Now, why did I bring this to the disaster thing? These mosquito breeding places, that is the habitat, these are created by the public. When the disease happens in a big number and havoc happens, we use the word disaster. If something happens in the family, don't you think it is a disaster for the family? Something bad happens in the family, one death, one sickness, one admission to the hospital, if not death, at least there will be a financial disaster to the family. Take it from me, because every day I play with patients' health, life, sentiment, and money. Every day I will be forced to play with these things. You have to take my sentiments from your heart. This is my earnest request. I have seen this bloody COVID disease as a doctor, as a general public, an Indian citizen, as a patient, and as a parent of 2 doctor children. When they were helping thousands of people in their teaching hospitals, we did not have good sleep for several months. I've seen this disease. Why I used to become angry at the public is, we are doing so much. and people are negligent. And this TV9 people came on a live interview from me. And that was a date, I think I have a slide on that. That was a date during which 6 crore people were affected and 38 lakh people had died in the world. And the TV anchor is asking me, sir, people say it is a hoax. It is sullu propaganda antaralla, sir, jana. This is the question it was asked on live interview. Look at this. I cannot become angry on a live TV because too many people will be watching. I said, sir, after 6 crore people being affected and 38 lakh people being dead, if somebody calls it a hoax, I have to really question their level of intelligence. This is what I said. So that is the definition of epidemic and endemic. Now coming to pandemic. See, in 1918-19, that is the First World War era. If you go through this, you will get to read this particular line. With modern modes of travel, what I am telling you is 100 years ago. What was the modern mode of travel then? I don't know. Now, the present thing, many of you might have experienced having your breakfast in Bangalore, lunch at London, dinner in New York. Most of us have passed through this phase. This is, if that itself is modern mode of travel, I don't know what terminology we can use for the present mode of travel. So a pandemic is an epidemic. It affects in wider geographical area, often global. Sometimes we cannot even pinpoint from where the spread happened. From where did the seed come? I was involved with the investigating agencies in early 2020. I think you had heard of this Jubilant factory in Nanjangud, which is close to Mysore. Police used to take me to that factory for investigating the thing. We were unable to do that. It was totally unconnected to their occupation. It was one individual to whom somebody from Bangalore visited, and they had history of going to some big conference or something. From there, they left it at Nanjangud. That visitor spread it to about 12 people in the factory. Look at this. We will not be able to trace this also. Many times we will not be able to trace this. So this is pandemic. In H1N1, we did not have this lockdown, cancelling of flights, people being afraid. With the 3 rupee surgical mask, we handled our H1N1 patients for more than a year. I used to spend, with one patient, I used to spend hours together in the ICU. I had taken the vaccine, and there was a good prophylactic medicine also, not just vaccine. So if I get exposed to H1N1, I can take a medicine and prevent myself from developing a full-blown disease. That's it. Okay. So this is the nature of the pandemic. Why I request you to take my advice from the heart is, when was the first that Janata curfew was imposed? If I am correct, it was on 22nd March 2020. That was just a test from our Honorable Prime Minister, how the people will react to this lockdown. That was a test. I have to tell you two things related to this. One is, it happened from 6 o'clock to 6 o'clock, 6 a.m. to 6 p.m. At 7 p.m., people started celebrating the success of Janata curfew. Is there any meaning? I was in a group on WhatsApp. I said, this is foolish to celebrate. This article itself is a nonsense. There is nothing to celebrate. There is a big thing coming up. Somebody questioned me, who is not known to me. He was also there in the group. Yen Swami article yenagide. This was the thing asked to me. Then I just explained in 2-3 slides, and I came out of the group because I felt it is not good to be in such a group. That was the first thing that I wanted to tell you about Janata Curfew. Second thing, 8 days before that, on 14th March of 2020, I held my first meeting in our campus. I just went to Vice Chancellor's residence and told him, sir, a big thing is going to come up. I am the subject expert. Please advance the dates of the exams. Please make way for online payment of fees. I don't want big crowds of students to just pay the fees. We buy 10 rupee worth article on Amazon, Flipkart and all. Why don't we create a payment gateway so that students will be able to pay it directly wherever they are sitting at 8 days in advance. Believe me, 2 statutory officers of University of Mysore were laughing at my talk. About a month later, I really caught them in the next meeting. You people were laughing when I told you this. Then they apologized. I said, don't apologize to me. My this thing is, in the last 27 years of my life in university hospital, had I come to anybody with this big warning? So if a sensible doctor comes to us with some warning related to health, you people did not have the courtesy, decency to just wait and analyze what is there in store like. That is it. Now, look at the global medical emergencies, plague, influenza of that time, cholera, typhoid, and in our own country, Surat, which is termed presently as the best city in India, it was the worst possible city when the plague epidemic happened there. Our own H1N1 in 2009, 2010. And now and then we keep on hearing about Zika virus, Ebola virus, 1 or 2 cases of Zika. Even very recently, it appeared in Kerala. Ebola, it did not come to this thing. But I was asked to give some talks on this. Anyway, I spoke on Ebola only for 1 or 2 minutes. That's it. So now, why are we discussing these type of health-related issues as catastrophes? That is a disaster. Like, I don't think I have a slide on plague. See, if somebody gets plague because of the present day social media, if some people who do not have a command over the subject, if they start telling that this particular individual, this particular family or community is responsible for the onset and spread of plague, without even analyzing, they will go and kill them. This is what happened in Europe when the plague was a scourge in early 1900s. Many thousands of communities have perished. Just take this as a key word, write it down on just scribble it down. Whatever I am talking, some interesting keywords, note it down. Surf this, plague. It is almost like our Ganesha drank milk, no? The Ganesha idol drank milk a few years ago. So I don't know who created this news, but it spread like wildfire on the media. Even social media was not that active at that point of time. Everybody started feeding milk to the Ganesha idol. This is what, good or bad, this is what happens. Good people will not get carried away fast. But bad things, you know, whatever comes up, they don't even analyze. They will just keep on forwarding the messages, causing a very big problem to us, to sensible people, to the police, to the government, to our healthcare professionals. So government, they have to cater to not just the physical needs, even to the emotional needs of the society. They will be in a big fix. That should not happen. So I want you to prepare some 1 or 2 paragraphs on each one of these headings. Look at this. This is a YouTube snapshot. Please note down this. Go through this. This is about 1 hour. This thing, stopping the pandemics. You go through this. Very interesting. This is not a slide made by me. If Dr. Swami is still there in this group, he will be laughing at this slide because my talk never ends without this particular slide. This man is a doctor. In 1958, he was awarded Nobel. He said, look at, just read it. The single biggest threat to man's continued dominance on the planet is the virus. And maybe after about 60 years or so, we were facing the same problem. I don't know whether he had coronavirus, COVID virus in his mind. He had virus in his mind because it will just spread like wildfire. Virus. So I used to be online. I gave a talk to two talks to a UK university, Indian perspective of COVID, Indian perspective of COVID vaccine. Twice I was just invited for the talk. So virus, any amount of your preventive strategies by social distancing, wearing a mask, washing hand cannot be 100% foolproof method. I am not discouraging individuals from following these three preventive steps, but virus is such a dangerous thing. It will just spread like anything. I will give you my own example. On the Gauri festival day in 2020, 21st August, I was still doing some puja at home with my family. Our then registrar called me and said, sir, one of our professor, he is having low oxygen concentration. Somebody has advised him to take 1 or 2 hours of oxygen inhalation. Please help him. I know that it is going to be a disaster, but as a doctor, I cannot refuse to treat a patient in need. Immediately, I rushed to the hospital. There were 6 people in the hospital. This particular professor, I think most of you have seen that pulse oximeter. When you put that meter into your finger, a normal child will be showing 9900, an adult will be showing 9899, an unaffected adult. But this particular patient had 39. The saturation level was 39. I told my staff, he is going to succumb. This is impossible. He will never make it. I just told, but we just made arrangements for him to be shifted to a higher center because just oxygen was not enough. He needed a invasive ventilation. Trust me, before we could start him on in invasive ventilation, he died. He was only a 48-year-old individual. And the second part is 6 of us who attended on this patient, actually 3 of us attended, 3 other were my other patients who had come for diabetes or hypertension. 5 of us became positive in the next 3 days. With me, another 3 members of my family became positive. You can understand the amount of disaster what we had in our hospital and in my family. That is why when individual is affected, the family will definitely face a health crisis and a financial crisis. So we have to honor this is not just a propaganda slogan. Dr. Joshua Lederberg created this with experience and empiricism. With due apologies to my Maharashtra friends, I think even those people will be aware of our Lord Basavaraj. See, in Vachana, there are 2 words, Anubhava and Anubhava. Anubhava is experience. Anubhava is empiricism. People considering the long-term consequences of our day-to-day small decisions. That is Anubhava, empiricism. So, if we have to prevent some havoc, disaster happening in our lifetime, we have to take care of small day-to-day things in our day-to-day life. That is what empiricism means. So this man was definitely a Anubhavi, not just Anubhavi. He was a Anubhavi. We have to really respect the sentiments of these people. Now, Alexander Fleming, we know him for penicillin. He himself said, even he was awarded Nobel much before Joshua Lederberg. He says, it is not difficult to make microbes resistant to penicillin in the laboratory by exposing them to concentrations not sufficient to kill them. Read it during your free time. The feudal kings, they had the fear of being poisoned by somebody. So what they used to do, they used to take small quantity of poison, thinking that it will give them some resistance, even if they are exposed to a bigger amount of the same poison. Feudal kings. We have read it in some novels. It will be there. In our forensic medicine book, we have read it. People isolating some sort of heavy metals from hair and all. From where did the heavy metal come to the hair? Because they were taking it. They were taking it, thinking that it will give them some resistance. Similarly, we people go to the medical stores and ask casually for an antibiotic. That's why I said in the beginning, if you give money, the pharmacy will give you poison also. Why only antibiotic? We don't know, even that fellow doesn't know the dose and course of the antibiotic. The most misused antibiotic is amoxicillin. You go and ask Amox, Novomox. All of you know, particularly people having children at their home. But what happens? Amoxicillin must be given in a dose of 30 milligrams per kg body weight per day in 3 divided doses. That means to say, if somebody is weighing 50 kgs, he need 3 capsules of 500 milligrams per day for a minimum period of 5 to 7 to 10 days till he is completely cured. If an individual takes 1 or 2 doses, the bacteria responsible for the infection will not expose itself to a higher concentration. It will develop resistance. So these days, bacteria are developing resistance to most of the known antibiotics. Trust me, sometimes I end up giving 8 to 10,000 rupees worth antibiotics per day for 7 to 10 days, the patient ending up spending 50,000 to 1 lakh on antibiotic alone. Imagine my fees, hospital fees, other things which are required like IV fluids and all that, and other medicines. Just antibiotic itself, 50,000 to 1 lakh. Just imagine the thing. That's it. Now, this, not for this particular crowd, I made it. Maybe it has just come like that. So there are many, many important antibiotics in this list, and bacteria are becoming resistant to even the most expensive of the antibiotics. That's it. Oh, sorry. I thought of removing it. Anyway, it is still here. Don't worry about that. So this will increase healthcare cost, and we will go back to the pre-antibiotic era, because the simplest antibiotic, simplest infection like sore throat, it will become deadly. That is it. See, other sentence made by Joshua Lederberg, we live in an evolutionary competition with microbes. Understand the sentiment. It is just a simple 4 or 5 words. But for people like me who understand the deeper meaning of this sentence, wow, it is something very big. We live in an evolutionary competition with the present mutation that is happening. Too many COVID strains, what we are hearing, that COVID-1, then Delta, and some other things came, and all that. This is naturally, it is mutating. That is the evolutionary competition. Coronavirus is not new to the world. The newly mutated strain, whether it is a natural mutation or some idiots did some genetic maneuver inside the lab and spread it accidentally to the atmosphere, infecting many animals and man. We don't know. It is still a hypothesis. Only it is to the World Health Organization to investigate it. That's it. Now, look at the next sentence. There is no guarantee that we will be the survivors. What does it mean? Instead of we killing the bacteria and viruses using an antibiotic, the bacteria and viruses may kill us and the whole human race may perish. This is what is the meaning of that. I'm not threatening anyone. I'm not trying to create a sort of tension among you people. That's it. Look at this. Some other medical expert. The microbes are challenging us in ways we would not have imagined 10 years ago. These are not newly made during COVID. I'm telling you, these are all 10, 20-year-old things for me. And these things may be several decades old. The sentiments expressed by these people. I have been using these quotes for the last 13, 14 years now. Microbes are challenging us in ways we would not have imagined 10 years ago, for which we are not prepared. Look at this. With the ongoing COVID havoc, we have experienced it. Each one of us have experienced it. That's it. Now, coming back to this non-communicable thing, how a disaster can happen. Just look at this. This is not even a word is typed by me. I've just highlighted some things. And some of you might be aware of this also. There is something called Cancer Express train. And one intelligent press reporter, while interviewing some of the patients, came to know that too many people traveling in this particular train are suffering from cancer. He went back and investigated, and they were all coming from an area in Punjab. When you deeply dig into the reasons, these people were farmers using too much of pesticide to save their crops. A continuous high exposure to pesticides is responsible, not was, is responsible for this big cancer number of that particular geographical area. Why can't we use the word disaster for this? I've just given you one slide. Ask your students to give a 10 minutes talk on this, because you will get plenty of resources on the net. You can verify the authenticity of this particular slide. Then water, sanitation and hygiene. Wash. Some of you will be surprised if I tell you there is an International Hand Washing Day. Independence Day. See, International Hand Washing Day andre, shall we wash only on that particular day and forget the remaining 364 days? This is what we people are doing. We do Dinacharane. Dina Acharane illa. We Swatantra Dinacharane. One dina madu. Do it on one day and forget the rest. Women's Day. One dina madu. Just give respect for a woman on that particular day. Aita? Avateno present kotbuda. That matadbuda. Children's Day. What is this? This repeatedly I'm requesting you, try to go through this, my sentiments. Who is talking is not at all important. What he is trying to speak is very, very important. That's it. A simple step of washing hands. Every day, see, how many students are there in University of Mysore hostels? Thousands. I get to see at least 10 diarrhea, dysentery patients every day. A simple carefulness about their food is more than sufficient to prevent this from happening. Scabies, a good thorough scrub bath every day will prevent them from developing. The tomiculate mite responsible for scabies, unless it stands on the skin for more than 24 hours, it cannot burrow through the skin and cause the disease. It will get seeded, but it will not cause the disease. One thorough scrub bath. Even if our clothes are torn, it is our cloth. We can wear it, but we cannot use others. Such a simple things will lead to a havoc or a disaster. That's it. So whatever it is, Don't ever try to think of only the big things that come on media. Iga California flood. Nodi Kannada TV nodi ನೀವು. ಅದು ಯಾವುದೋ 10 ವರ್ಷದ್ದು ಒಂದು ವಿಡಿಯೋ ಕ್ಲಿಪ್ಪಿಂಗ್ ಹಾಕ್ಬಿಡೋದು. ನೀರು ಹರ್ಕೊಂಡು ಹೋಗ್ತಾ ಇರೋದು, ಲ್ಯಾಂಡ್ ಸ್ಲೈಡ್ ಆಗ್ತಾ ಇರೋದು ಹಾಕ್ಬಿಡೋದು. ಕ್ಯಾಲಿಫೋರ್ನಿಯಾದ. I will speak to my friends in that particular state of US. In maybe in 2-3 places, my friends and relatives are there. They laugh at us. Arey, there is unexpected rain. There is nothing like a massive flood and all. What you are seeing is all something that has happened in some other country, some other time. Look at it. That should not be, that is almost like a propaganda. That's it. Who cares for it? Mangalore will disappear in 100 years. Adu nodirbekkala neevu. One sensible public will call that TV fellow and question. A 100 ವರ್ಷಕ್ಕೆ ನೀನೇ ಇರಲ್ಲ ಏನ್ ತಲೆ ಇಲ್ಲದೆ ಮಾತಾಡ್ತೀಯ ಅಂತ. That's it. Mangalore, sea erosion is there. We should not stop at the problem. We should advise the concerned authorities to prevent something, or do something to prevent the sea erosion. That's it. It is there from time immemorial. Land ittu, ocean ittu, sea erosion idde ide. Idralli. It is not new. We should not just create just a problem. We should give the solution also. That's it. Cholera, very recent, very recent. Look at the date. There is an arrow I have put here. 16th December. I was just trying to look at it because the last cholera thing what I saw in Mysore city was 1994, 93-94. With the same National Institute of Communicable Diseases, I conducted a training program for our doctors here. Because we knew as subject experts, vaccine is waste. People were coming for vaccine. We used to give, but we know that it is a waste. That's it. But look at it. In some of the things, there are deaths. There are deaths, too many deaths also. Just analyze the slide because it is a very tiny one. Go through this, just analyze. I just showed, but somebody traveling to this area may pick up the Vibrio cholera bacteria and keep on transferring to the places where they visit. That's it. So let us stop at this and I will try to take some questions. You can unmute. All of you can unmute and I want to say take some questions before the break. Dr. Anjanappa sir, you were there from the beginning. You are the first person whom I saw. So I will give you the privilege of asking me the first question. ಅವರೇನೋ ಬೇರೆ ಬಿಸಿ ಇದ್ದಾರೆ ಮಾತಾಡಕ್ಕೆ. ಬೇರೆ ಏನೋ ಮಾತಾಡ್ತಿದ್ದಾರೆ ಅವರು. Okay, anyone please? Unmute and ask. There are 50 people, not even one question. What is this? Our friends from Maharashtra.
Sir, excuse me, sir. I am Sudhakar from Tumkur, sir.
Sudhakar sir, really sir.
Sir, about endemic, about little bit you can explain, sir. A little bit endemic means little bit still existence of malaria, dengue.
Endemic.
That you tell me, sir.
Okay, sir. Okay, sir. Endemic, I defined it as habitual presence of the disease producing agent in a specific geographical area. So the malarial parasite Plasmodium is present in that geographical area. But when it gets an opportunity to spread, say I told you, it needs the via media of the mosquito to spread. An individual suffering from malaria his blood will be having circulating parasites. When the mosquito feeds on that particular individual, it will pick up the parasites, and after 10 days of maturity, when it feeds on the other healthy individual, it will inject this malarial parasite into that fellow. He will develop the disease symptoms. Because the number is not very big and it is seen throughout the year in small numbers, we use the word endemic. Okay, habitual presence of the disease producing agent in a specific geographical area is endemic. Epidemic is a sudden increase in the number of patients for a particular disease in a geographical area, which is clearly in excess of the usual expectation. The number, if I am expecting 100 cases this year, if I see more than 100, it is epidemic. It involves a bigger geographical area. That's it. Yes, sir.
In the meaning wise, endemic means it will never end, or else it may end also, sir.
Yeah, a hypothetical question. All these diseases, what we are talking about, dengue, chikungunya, malaria, we cannot say that we have eradicated. But see, smallpox was such a havoc. Now we have even stopped vaccinating our children. Maybe you are vaccinated, I am vaccinated for smallpox when we were born. But maybe after mid-80s, children born after mid-80s, we are not vaccinating them at all because the virus responsible for smallpox is not there in the entire world. Similarly, we thought we are almost on the verge of eradicating polio, but suddenly there is an increase in number. Last week in our meeting, we were discussing about vaccine-induced polio. That's it. Is Dr. Swami here?
Thank you, sir. Thank you very much.
Okay.